benefits and risks, where does AI fall when it comes to
Mm.
educating the next generation of healthcare professionals? Our next claim, in fact, is healthcare students should use AI. And to get a grasp on whether or not AI belongs in healthcare education, I pose this question to our fellow editor, Vickie Danaher, PharmD. She's written a lot of our great content on AI, including an article in Pharmacist Letter on this very topic. So let's see what she had to say. Thank you for joining us, Vicky. And I'm curious, what is your take on this claim that healthcare students should use AI? What benefits do you see, and are there risks?
Yeah, definitely. Thanks for having me, Steve. So, AI is already becoming a part of healthcare, as you guys have talked about already. So, ignoring it or not talking about it with students or using it on learning experiences isn't really going to prepare them for the real world. We know that patients are using AI, they're looking for it for questions on drug information, health information, and they're coming to us to ask about it. So we want to really make sure that patients or make sure that students are prepared for the real world that they're going to be living in and working in.
Yeah, the cat's already out of the bag.
Definitely.
So, what are good examples then you suggest listeners should think about if they want to use or integrate AI into teaching?
Yeah. So, as a pharmacist, one of the main examples that comes to mind for me is drug information questions. And so, patients are coming to us with questions or clinicians have questions. And there's really kind of two ways that we can work with our students to approach those questions using AI. So,
Mhm.
one way might be for students to prepare a response to a drug information question the traditional way. So, consulting primary literature, consulting databases, writing up the response on their own, and then using AI to generate its own response and kind of comparing those two versions. So, was there something that AI missed, or was there something that the student missed, or they thought of something differently? And that can really kind of be an area to improve their clinical thinking or their clinical judgment. Another option would be to have the student use AI to start off the response to the drug information, kind of using it as a starting point and kind of critique what it comes up with up front and then revise it and build upon it to create a solid answer to that drug information question. But I think so those are two different ways, but I think they're approaching it or the outcome is the same way. You're still looking at that response or the information that AI is producing, you're evaluating it, critiquing it to ensure that the answer is solid.
Yeah, lots of options and both lead to great learning. So, what would you say or recommend to listeners who may still be hesitant to use AI with learners?
Yeah, I totally understand the hesitation and, there's many issues kind of surrounding AI and so forth, but I would say the more that I've used it, the more that I've experimented with it and so forth, you build that understanding and that awareness of its capabilities and its limitations. You as well as students will learn like what needs to be verified, and you know that you can't trust it completely, but you can use it as a tool to support the work you're doing.
Excellent. Excellent thoughts. And I'll be looking forward to sharing these with Don, and hopefully we can calm some of his fears around AI. We'll see. But thank you for joining us today.
Sounds good.
Wow, so another great interview, Steve. And I'm glad to actually have Vicky on for once on our podcast. It's great to see her. But I have to circle back on what you capped on in the end here. And who said I was afraid of AI? Speak for yourself,
Oops, I may have spoken too soon. Don, I put words in your mouth.
right?
But okay,
But
we we can say here and now, we can document for the record. It is a rumor that Don is afraid of AI.
right, and this is recorded, so it's officially on the record, right? And you may have noticed we brought in two experts this time, voices for our podcast, which is actually new for us.
Yeah, and that's intentional. With AI, the best outcomes happen when you keep multiple experts in the loop. So we figured we should practice what we preach.
Right, and honestly, that perspective really showed here. I really liked her suggestions for integrating AI into education. Practical ideas that also teach us how to balance AI's benefits and risks in everyday use.
Exactly. So when it comes to this claim that healthcare students should use AI, the verdict is true with conditions.
And I agree, AI is it's not going anywhere, right? So we shouldn't turn a blind eye to it. And evidence suggests students are interested in using it.
Right. And we're in a prime position to guide learners on proper use and knowing how and when to dig deeper when AI provides any suggestions. We don't want learners approaching AI with fear, maybe just a healthy amount of vigilance instead.
We don't want learners outsourcing their thinking. We want them sharpening it, right? So if we want more structure and examples, you can actually read Vickie's excellent article in the January 2026 issue of Pharmacist Letter, Pharmacy Technician's Letter, and Prescriber Insights to help you with ideas for incorporating AI when teaching learners.